My name is Janelle and I'm a registered nurse, and today we'll be talking about tinea. Tinea is another name for a group of diseases caused by fungus. We all know them as ringworm or athlete's foot. They're dermatophytic infections. There are 4 types of tinea. Tinea pedis, which is ringworm on the foot, which is also called athlete's foot. Tinea corpus, which is ringworm of the body. Tinea cruris, which is ringworm of the groin or jock itch. And Tinea capitis is ringworm of the scalp. You can contract these fungus disorders by just touching the other person. We know that when we're at the gym, we should wear flip-flops because it's a moist environment, and people who have athlete's foot and do not wear shoes can spread it to others who are walking around the gym area without shoes. So you can just contract it by touching the other person. Again, shower floors, and you can even get it from your pets. Tinea is not a worm, a real ringworm, and it doesn't cause it. So that's an old wise tale that the tinea or ringworm is a real worm, but it's not. Signs and symptoms would be a red skin rash that forms a ring around normal looking skin. You can have it also under the pannus folds of an obese person, or women sometimes if they have really large breasts and they are folded over, you can also get that tinea underneath the breast. So on the scalp, it would be itchy red patches and can leave bald spots. We usually see this in children. On the groin area, it would be itching and it would be a burning rash. On the foot, let me go back to the foot, it can get so bad as to have cracks on the heels, which would cause lesions that would leak out fluid, and this would set you up for a secondary infection. I guess all of these areas could possibly be turn into a secondary infection if they became open and the wound was not taken care of properly. I'm going to now talk about treatments. For tinea pedis on the foot, responds well to topical therapy, and there are many over-the-counter creams that you can buy for that. Chlorotrimazole, Desinex, Spectazole, Nystatin, Lotrimin AF, and if you find that you're set up for a secondary infection, I read on the internet where you could, this would be a home remedy where you could get a basin of warm water with 2 capfuls of iodine and soak your feet in that, and that would help to prevent the risk for infection. Let's see, you would also want the patient to wear absorbent cotton socks. Change shoes often. Don't wear the same shoes for like 3 years. Dry feet after bathing, because the fungus likes a moist atmosphere. So if you don't dry off your feet and you put the sock on, all that moisture is just making that fungus grow more and more. Tinea corpus, the treatment for that usually responds well to the over-the-counter creams. Any creams with the azole at the end would work, like the ones I talked about before, chlorotrimazole, iconazole, and micanazole. Let's see, any of the creams that are allylamines, and that would be butanafine or naftifine. let's see, continue until these creams you want to use for a week and maybe even another week after the signs and symptoms are gone, to make sure that you did get that fungal infection gone. So if it's real severe, you might need to take a systemic antifungal agent. These are also over the counter. Lamisil has a oral tablet, and Fulvicin PG is also sold over the counter. I'm sure if you went to the pharmacy and asked the pharmacist, they would assist you in retrieving that medication. Tinea cruris responds well to topical therapy, and you would also use that for 1 week greater than after the signs and symptoms are gone. If that doesn't work, again, we would have to use a systemic antifungal. And Lotrimin also has an oral tablet. The physician may add topical glucocorticoids to the regimen if it's that severe. Tinea capitis is very difficult to treat. Topicals probably won't work. Your hair is oily and the cream probably does not stick very well to the skin. So with that one, they usually give oral glycofulvin for 6 to 8 weeks. But what works even better is the terbinafine for 2 to 4 weeks. That is more effective, and it also comes in a tablet. So one more thing I would like to mention before I finish my video. This is just from personal experience, and I looked it up on the internet. So when I worked at the jail, there was a lot of athlete's foot going around there. So the prisoners, inmates / patients would urinate on their feet, and it would make the athlete's foot better. So that's just a little remedy that I've seen and read it on the internet. Thank you for your time.